My name is Juwan Fantana, and I'm a senior here at Mount St. Michael. So my disease was systematic lupus erythematosus. I don't know how to pronounce that word that well. But lupus is a chronic autoimmune disease that attacks like skin, joints, and other parts of the body. So basically, the disease attacks like healthy cells in the body, just like rheumatoid arthritis. It is a disease of flares and remissions, meaning that the symptoms can come and go, and it's not contagious. And it's estimated that 1.5 million people in the United States have lupus, and 5 million people around the country have lupus. So some symptoms of lupus include chest pain, fatigue, fever with no cause, general discomfort, hair loss, mouth sore, sensitivity to light, swollen lymph nodes, and facial rashes. Some digestive or heart, the other symptoms include like if you have in your digestive system, you have abdominal pain, nausea, vomiting, heart, you have an enlarged heart, you cough up blood, or you have like patchy skin colors like you see in this picture. And also like for the fingertips, you might have Raynaud's phenomenon, which is a disease which your fingers start discoloring in the fingertips. So some risk factors are lupus is more common in women than it is in men, and is even more common in African American women and Asian men and Asian women. So it's reported that women of color are 2 to 3 times more likely to develop lupus in their lifetime. And the test to diagnose lupus, you have to be diagnosed with 7 out of 11 of the tests. Like the board of doctors creates like a set of because it's not a disease like you can just say I have lupus. You have to have like a certain amount of tests you have to pass to be diagnosed with lupus. So some of the tests are like antibody tests, a complete blood count, a chest x-ray, a kidney biopsy, and a urinalysis. So treatment and the cause, there's no like real cause. They have not discovered the cause for lupus, and there's no cure for lupus. So the goal of lupus is to control the symptoms of lupus. So if you have like a severe case of lupus, you might use high-dose corticosteroids or medications to decrease the immune system, which are just anti-inflammatory drugs, which help decrease the joint pain and other symptoms of lupus. And you might use cytotoxic drugs that block cell growth. So like when you have the enlarged heart or other symptoms, it might just suppress your symptoms. Yeah, that's it. Oh, why did I choose lupus? Because I don't know, one day I was listening to the radio and it was like, donate money to the Lupus Foundation, and I was like, oh, what is lupus? And then we had to do this project, so I was like, okay, I might as well just choose a disease I didn't know. So I chose lupus. Huh? Oh.
After you're diagnosed with lupus, what is the average lifespan?
People live like 30 to 40 years. It's not a disease. It's like I said, it's a disease of flares and remissions. So you might have like a time period in your life where you don't show any symptoms at all, but then you might go through a period where you have like enlarged heart, like arthritis, increased arthritis, or you have the rash on your face. So it depends on your symptoms.